Most people think a stroke just happens. One minute you're fine, the next minute you're on the floor. And I completely understand why people believe that, because that's how it looks from the outside. That's the part that makes it onto the news. But what nobody tells you is what was happening the day before. And the day before that, your body was already sending you messages. Clear, specific, unmistakable messages. And almost nobody knew how to read them. My name is Dr. Miles Parker, and I want to talk to you today about something I see confirmed again and again in my practice. That strokes almost never come out of nowhere. They announce themselves, and the people who recognize that announcement in time are the ones who walk out of the hospital on their own 2 feet. I had a patient not long ago, woman in her late 60s, sharp, active, kept up with her health better than most people I know. She came in and mentioned, almost as a footnote at the end of our visit, that she'd had a really strange headache 2 days before. Different from her usual ones, she said. Pressure behind one eye. Lasted about 20 minutes, then completely disappeared. She almost didn't bring it up because it went away on its own. She thought that meant it wasn't serious. It was one of the most serious things she could have told me. We ran the right tests. We caught what was happening, and we stopped something catastrophic from finishing what it had already started. That's why I'm making this video today. Because the warning signs of a stroke are not mysterious. They are not random. They follow a pattern that has been documented extensively, and the tragedy is that most people have no idea what that pattern looks like. Today, I'm going to change that for you. I'm going to walk you through exactly what the body does in the hours and days before a major stroke. What most people mistake it for, what's actually happening inside, and the one thing you should do if any of this sounds familiar. Let's start with the sign that gets dismissed more than any other. The one that sent more people to their medicine cabinet instead of to an emergency room than I can count. A headache that is different from every headache you have ever had. Not necessarily the worst pain of your life. That's actually a common misconception. What makes this headache alarming is its character, not just its intensity. It comes on suddenly, or it sits in a location that feels unfamiliar, behind one eye, deep in the back of the skull, or it feels like pressure rather than throbbing, like something pushing from the inside. Most people reach for ibuprofen. They lie down in a dark room, and when it fades, they tell themselves they were probably just dehydrated or stressed or staring at a screen too long. What can actually be happening is this. A blood vessel in or near the brain is under significant strain. Sometimes a small bleed has already begun. A microbleed that the body temporarily compensates for. Sometimes a clot is forming and disrupting the normal pressure in the cerebrospinal fluid that cushions your brain. Your skull is a sealed chamber. Any change in pressure inside that chamber produces a signal. And that signal is a headache unlike your normal ones. Think of it like a pipe behind a wall. When the pressure inside that pipe becomes dangerously high, the wall doesn't collapse immediately. But you might notice a small crack, a slight bulge. That headache is the crack in the wall. The pipe is still holding, but it is telling you something is wrong. A large body of peer-reviewed cardiovascular research has found that unusual headaches in the 24 to 48 hours before a stroke are reported by a significant portion of stroke survivors. Yet the vast majority of them did not seek care at the time because the headache resolved on its own. My recommendation, if you experience a headache that doesn't feel like your normal headaches, different location, different quality, different onset, do not wait for it to come back. Call your doctor that day. Not tomorrow, that day. Now, let's talk about something that might already have happened to you or someone you love. And I want you to think carefully as I describe it. A brief moment where your vision went strange. Maybe things went blurry for a few seconds. Maybe you lost part of your visual field, like someone pulled a curtain partway across your sight. Maybe you saw double for a minute or two, and then it was completely gone, and you figured your eyes were just tired. This is one of the most critical warning signs the body produces, and it is almost universally explained away. Your brain has a visual processing center located at the very back, in an area served by a completely different set of blood vessels than the front of your brain. When circulation to that area is temporarily disrupted, your vision is affected. But because the disruption is brief, we're talking seconds to minutes, the visual disturbance resolves, and people assume the problem has resolved with it. It hasn't. The circulatory disruption that caused it is still present. The underlying instability is still there. What you experienced was what doctors call a transient ischemic attack, a TIA, or what some researchers call a warning stroke. The brain didn't sustain lasting damage in that moment, but only because blood flow returned quickly. The conditions that caused the blockage in the first place have not changed. Imagine you're driving and the engine warning light flickers on for a few seconds, then goes off. The light disappearing doesn't mean the engine is fine. It means the problem wasn't severe enough to keep the light on yet. Ignoring it and continuing to drive is still a serious mistake. Studies consistently show that the risk of a full stroke in the days immediately following a TIA, including visual disturbances, is highest in the first 24 to 72 hours. The window to intervene is real, and it is short. If you or someone near you experiences sudden vision changes, even briefly, even if they completely resolve, go to an emergency room, not an urgent care clinic, an emergency room where imaging of the brain and its blood vessels can be done immediately. Let's talk about the third sign, and this is the one that surprises my patients the most because it doesn't feel like anything brain-related at all. Sudden, unexplained dizziness. Not the room-spinning vertigo that often comes from inner ear issues. I'm talking about a dizziness that comes with a specific quality, a sudden loss of balance or coordination. You reach for something and your hand doesn't quite go where you intended. You stand up and feel unsteady in a way that's unfamiliar. You're walking and your gait suddenly feels off for a moment. People attribute this to standing up too fast, to not eating enough, to being tired, and sometimes that's exactly what it is. But there is a specific character to pre-stroke dizziness that distinguishes it. It tends to come on suddenly, without a positional trigger. It may be accompanied by mild nausea, and crucially, it may happen alongside any of the other signs we've discussed or will discuss. The part of your brain that controls balance and coordinates movement, the cerebellum and brainstem, sits at the base of the skull and is supplied by its own set of arteries. When those arteries are compromised, balance is one of the first things to go. And because the cerebellum is not involved in language or consciousness, people don't realize something neurological is happening. They just feel a little unsteady and sit down. Think of the brain like a large building with different electrical circuits running different floors. When the circuit serving one floor starts failing, only that floor loses power. If the affected floor runs the elevators, you'll notice you can't get from one level to another smoothly, but the lights on every other floor are still on. You might not realize it's an electrical problem at all. The critical distinction is this. Normal dizziness from dehydration or standing too fast is short-lived, positional, and doesn't come with other neurological symptoms. Dizziness that is sudden, unexplained, comes with any loss of coordination or is accompanied by other signs on this list. That is a different category entirely, and it deserves immediate medical evaluation. The fourth sign is the one I consider the most underestimated, because people almost never mention it unless you ask directly. Numbness or weakness on one side of the body. And I want to be specific here, because this is not the tingling of a leg that's fallen asleep from sitting too long. This is a numbness, or a heavy, weak feeling, that affects one side more than the other. One arm feels heavier. One side of the face feels slightly numb. One hand feels less responsive than the other when you try to grip something. It may last 30 seconds. It may come and go. And because it passes, people tell themselves it was circulation, or sleeping in a bad position, or a pinched nerve. The brain is divided into two hemispheres, and each hemisphere controls the opposite side of the body. When circulation to one hemisphere is disrupted, the opposite side of the body is affected first. This is the body's most direct communication that something is wrong on one specific side of the brain. Renowned neurological research has documented that unilateral, meaning one-sided, weakness or numbness is among the most predictive pre-stroke symptoms when it appears, particularly when it resolves spontaneously. The spontaneous resolution does not indicate recovery. It indicates a temporary restoration of blood flow that may not hold. A simple self-check. Raise both arms in front of you, palms up, and hold them there for 10 seconds with your eyes closed. If one arm drifts downward or feels weaker than the other in a way that is new and unexplained, take it seriously. Try to smile in a mirror. If one side of your face responds differently than the other, take it seriously. These are not anxiety-driven overreactions. These are appropriate responses to real signals. The fifth sign is the one that often makes people feel foolish when they describe it, because it seems so strange. Sudden difficulty with speech or with understanding language. It doesn't have to be dramatic slurring or complete inability to speak. In the hours or day before a major stroke, this can be subtle. Words that suddenly feel harder to find. A sentence you started and couldn't quite finish. A moment where someone spoke to you and the words sounded right but the meaning didn't immediately connect. A feeling like your tongue is slightly less coordinated than usual. People assume they're overtired, or anxious, or distracted. They make a joke about it and move on. Language is processed in a specific region of the brain that is heavily supplied by one of the most stroke-prone arteries in the entire cerebrovascular system. When that artery's territory is under threat, language is often the canary. It's the first system to show the strain, because it requires such a precise, coordinated supply of blood to function. Think of language production like a very complex orchestra. Every section needs to be functioning, receiving the conductor's signal, and responding in real time. When the blood supply to the conductor's position in the brain is disrupted, even briefly, the orchestra doesn't play. Words don't come, comprehension falters, and when the supply is restored temporarily, the orchestra starts again, and the person thinks the moment of confusion was nothing. There is no such thing as a nothing episode of sudden speech difficulty. If it happened without explanation, without extreme fatigue, without alcohol, without a medication change, it belongs in the emergency category. Not because it will definitely mean a stroke is coming, but because the cost of being wrong in the direction of caution is a hospital visit. The cost of being wrong in the other direction can be permanent disability or death. I want to stop here and speak directly to you for a moment. If you've been nodding along to any of these signs, if you recognize something in yourself, or someone you live with, or someone you love, I need you to take that recognition seriously. The whole reason these warning signs exist in medicine is because they precede the event. They are not the event. They are the alarm before the fire. And right now, the alarm is the most important thing. Here is what I want every single person watching this to know. The single most powerful tool that exists for pre-stroke situations is speed. There is a window of time, and that window is measured in hours, not days, during which an impending stroke can be intercepted, treated, and in many cases, completely prevented from causing lasting damage. Imaging technology and intervention options that exist today are extraordinary, but they only work when you get to a hospital while that window is still open. The signs I've described today are not obscure. They are not rare. They happen to millions of people every single year, and the vast majority of those people explain them away, wait to see if they come back, and call their doctor when it's convenient. By the time the full stroke arrives, the window has often already closed. I do not want that for you. Learn the acronym FAST, and then go beyond it. Face drooping, arm weakness, speech difficulty. Time to call emergency services. That's the starting point. But now you know that the hours before a stroke can also include an unusual headache, brief vision changes, sudden unexplained dizziness or loss of coordination, and one-sided numbness that comes and goes. These are not possible symptoms. These are documented pre-stroke events. They are your body doing everything in its power to tell you something. The action I'm asking of you is simple. If you experience any combination of what I described today, especially more than one of these signs occurring within a short window, do not call your general doctor and schedule an appointment. Do not Google it for 30 minutes first. Call emergency services, or have someone drive you to an emergency room immediately and tell them you are concerned about stroke symptoms. Those words will trigger the right response. And if you're watching this and you feel fine, share it. Put it on your Facebook right now. Tag your spouse. Tag your parent. Tag the friend who mentioned something strange last week that you both laughed off. You genuinely might be handing someone the information that saves their life. I post here every week. Things I talk to patients about that most people only hear when something has already gone wrong. Subscribe so you never miss one. And if this helped you today, leave a comment below and tell me which sign surprised you most. I'm Dr. Miles Parker. Pay attention to what your body is telling you. It's usually been speaking longer than you realize.